What does informed consent for clonidine look like? My name is Dr. Ruth Dotton. I'm a board certified adult psychiatrist, and I'm going through a series where each day I talk about one of our most commonly prescribed psychiatric medications and how I would go through the informed consent process with one of my patients. And today we're talking about clonidine. Now, I will say I do not often start clonidine. It's not my favorite medication, and we'll talk about why later. But I do certainly inherit a lot of patients on this medication, and a lot of people do say that it's quite helpful for them. So when clonidine is used in psychiatry, it's usually being used for insomnia or anxiety. We see it a lot used in kids who have ADHD, either for agitation or to help them to fall asleep. It's also used to treat withdrawal from different substances, and so it can be helpful for things like opiate withdrawal. Now, it was originally designed as a blood pressure medication. It's not one that's commonly used now for this purpose because you have to dose it 3 or 4 times a day to get consistent, stable blood pressure control because of a thing called rebound hypertension. What that means is when a dose wears off, then your blood pressure is actually going to spike higher than it was before you took the dose. So we have lots of other blood pressure options now that don't have that issue, so it's not commonly prescribed for this. But there are a number of other potential indications. It can be used for migraine prophylaxis. It can be used for perimenopause symptoms. It can be used for restless leg syndrome. So lots of different potential reasons that someone might be on this, and I definitely see it quite a bit in my practice. As far as side effects, it can cause things like sedation, dizziness, stomach upset, headache, dry mouth, dry eye, constipation. And although it's supposed to help with anxiety, irritability, and insomnia, some people will have a paradoxical reaction where it actually makes those things worse. Sexual dysfunction can be another potential side effect. Of course, as far as safety concerns, it's a blood pressure medication, so we worry about someone's blood pressure dropping too low, causing dizziness, fainting. And if someone has a cardiovascular history, then it's important that they check with their primary care and or their cardiologist to make sure that it's safe for them because it can affect cardiac function as well as interact with other cardiac medications. It's not something that you can stop all of a sudden because of that rebound hypertension. It has to be tapered off slowly in order to maintain a stable blood pressure. Now, why don't I really like it? There's a couple of reasons. One is the blood pressure issue, because when people are taking it for psychiatry, they're often taking it once or twice a day. And so their blood pressure is going to be unstable throughout the day. It's also hard to get off of, which makes things difficult. But the other reason is that it's pretty sedating on its own, but it also is extra sedating when it's combined with other sedating medications or illicit substances. It does have abuse potential because it can elicit a high when it's used in combination with other substances. And of course, because of that, there is an increased risk of respiratory depression and overdose, which can cause death. So it's just not my preferred medication. I certainly think a lot of people use it safely, but it's not one that I generally start. But I'd love to hear from you. If you've had an experience with clonidine, either positive or negative, go ahead and share in the comments below. Or if there's another medication that you want to hear me go through an informed consent process, I'd love to hear about that too. Wishing you all good mental health, and I'll see you in the next one.